Welcome to this AsIAm explainer. In this video, we will explain the DPO Network submission to the Joint Oireachtas Committee on Autism, Children and Health. The Joint Oireachtas Committee on Autism heard from various community members and their experiences in Irish society. The committee paid particular attention to the United Nations Convention on the Rights of Persons with Disabilities, which states that state bodies must closely consult with and involve people with disabilities through their representative organisations. Many disabled persons organisations, like AsIAm, were consulted by the Joint Committee. The DPO Network is a group of 5 DPOs that include AsIAm, Disabled Women Ireland, the Irish Deaf Society, Independent Living Movement Ireland, and the National Platform of Self-Advocates. Collectively, the DPO Network are members of the Disability Participation and Consultation Network. The DPO Network submission to the Joint Oireachtas Committee gives recommendations to improve autistic lives in various areas of society. These recommendations are based on consultation with the autistic community about their lived experience. Children. According to the community, 2/3 of young people are waiting up to 2 years before getting an autism diagnosis. Even when they get a diagnosis, full supports are rarely available for autistic children. This contravenes Articles 7 and 25 of the UNCRPD. The DPO Network makes the following recommendations. Full legislative review of the Disability Act 2005 under the Joint Committees on Health and Disabilities. Based on this review, they should reform the Act's provision of services along a child-centred approach in line with the UNCRPD. The DPO Network also recommends investing in early identification, hiring additional psychiatrists and clinical psychologists for areas of need. Health. The full range of necessary supports for autistic need are rarely available. There are presently no supports for autistic adults. The DPO Network also observed a lack of autism awareness and training in medical professionals. Similarly, a lack of coordination or communication between professionals led to inconsistent care for autistic people. Finally, the submission drew attention to the overwhelming experience of navigating services which were not designed with autistic access needs in mind. The DPO Network makes the following recommendations. Establish a public pathway of support for adults seeking an autism diagnosis. Introduce a national post-diagnostic service to support autistic people after their diagnosis. Oversee the training of counsellors and mental health professionals to ensure young autistic people can access child and adolescent mental health services. Review the current parameters for diagnosis to ensure it is neuroaffirmative and non-traumatizing. Ensure competent diagnosis of people with different disabilities, genders, ethnicities, and socio-economic backgrounds. Introduce measures to improve accessibility of healthcare for autistic people, such as multiple contact options for those who prefer written over spoken communication. Introduce targeted supports for autistic people accessing prenatal and postnatal care. Stay tuned for the next video, which will discuss the DPO Network submission's recommendations for employment and social protection and justice and equality. Thank you for watching this AsIAm explainer.